Hi, Dr. Peter Montgomery, family practice doctor, here to talk to you more about the COVID crisis. Today's message is COVID, cold, or flu. Very complicated. You're not feeling well and you're like trying to decide what is it and should I call the doctor or even get more help. I'm going to try and help you get inside my mind as I try and figure this out with my patients. Every episode, I want to talk about the 5 W's to stop the coronavirus. Just to keep reinforcing that we got to do this. We're all in this together. We're all in lockdown together now. Everybody needs to be doing this for this to work. We are washing. That's obvious. We should have been doing this all along, but let's just keep it up. We are waving, social distancing, keeping 6 feet apart from people. We are wiping down surfaces. It lives on surfaces for days. And whoa, don't touch this. This is how it gets in through the mouth, through the nose, and through the eyes. So now you're not feeling well. What is it? I work for SSM Health here in St. Louis, and on our website, I'm going to show you a little chart they have to help you figure it out. And let me go through that with you right now. Thanks. Sometimes you're not feeling well and you don't know what you have. I work with SSM Health in St. Louis, and our website has a graph here that may help explain some of the symptoms. For the COVID-19 coronavirus, very common that people have a fever. They feel tired and achy. General malaise is sometimes what it's called. You just kind of hurt all over. And it's usually a dry cough, usually not bringing up mucus early on. And they mention difficulty breathing and severe. All the articles I've been reading and from the handbook from the Chinese group that's been fighting it, the fever is usually low, 100, 101, whereas the flu, the fever is often 102, 103 is a story I hear often with that. And sudden onset, the COVID is described as a slow burn. The fever usually is just persistent at this low 100-degree level to 101-degree level for a week. Safe to say 5 days before things start getting worse in most cases. Few cases I've heard of people, running a fever in 2 days, but maybe they just weren't picking up the symptoms early on. But the best way to describe COVID is a slow burn, and influenza is a truck hit you. Everything happens very suddenly. In 25 years of people coughing on me and taking my flu shot, I've only gotten influenza once, and it was sudden. All of a sudden, I had the vomiting type, but diarrhea can happen. Sudden onset of high fever to 102, instantly could barely function. After the vomiting, I was coughing. The short of breath does happen. People do get pneumonias with influenza. The aches and pains, I thought I was sleeping on concrete. I have a 2-inch thick memory foam topper on my mattress. Yeah, I'm a wuss. But yeah, I thought I was on concrete. Everything hurt all over. My eyeballs hurt. It hurt to blink. In my office, people come in. I look for what I call pajama sign or fuzzy slipper sign. When someone comes in and they are crashed out on the examination table and they're there with a family member because they couldn't drive themselves, I go, oh, you have the flu. Because they're seeking comfort and they're wearing the most comfortable clothes. COVID is a lot slower onset. Most of the stories, people are sick for a week with a low-grade fever and these symptoms. Then the shortness of breath hits. At that point, action needs to be taken. You need to be seeing your doctor. Rapid COVID test would be best. Currently, there is a delay for the time of testing to getting results. I personally am not waiting for test results to start a medication that has been around for 70 years that is very safe. I'm out on a limb on this, but I think everybody will come around to this thinking very shortly. The Chinese documentation on their treatment says timely starting of antiviral medicine is essential. And I would say if you've had a fever for a week, talk to your doctor and consider getting on antiviral medicine quickly, especially in your high-risk group. People over 50 and definitely over 60 are dying at higher rates. and people with underlying medical conditions are at a higher risk. They do mention the aches and pains in a lot of the articles. It's, again, just a mild, slow burn kind of thing. The Chinese document said 50% of people had diarrhea. I would describe it as a severe diarrhea, but there's definitely some GI symptoms early on before the other ones get started. A common cold, much more to have sneezing. Not a lot of sneezing with this, not a lot of sneezing with the flu. A lot of, cold and allergies are very commonly confused, as you can see this common group of thing here, the sneezing, the runny nose, the stuffy nose, the watery eyes. I know when the trees around my house are blooming because I can't stop tearing up in my eye. The sore throat, with the cold, you get the sore throat confused with strep. We can do a rapid strep test or a strep culture, see what's going on there. But again, these things, I have not heard any of these symptoms, these cold or allergy symptoms, happening with coronavirus. I would agree with that, except for the aches and pains. Again, mild, slow, lingering symptoms for 5 days to a week. Seek medical advice.
Okay, to summarize, COVID, slow burn, low-grade fever, body aches, not feeling good for days to a week, then shortness of breath, seek help. If early on, if you're feeling the symptoms for even a couple of days, I would try and get a COVID test. Influenza hits like a truck, sudden high fever, severe body aches, can't function at all. Okay, so colds. Seems a lot like allergies. Colds, allergies, hard to tell. Cold might have a fever on day 1 and then it goes away. Definitely no significant fever on day 3. So day 3 of a fever, flu or COVID, depending on how severe it is, make the guide there. Allergies, go ahead and take your allergy medicine. I don't think you're going to be covering up any COVID symptoms because they're very different. There's a lot more runny eyes, sneezing, and drainage, which is not what the COVID seems to be like from what I've read. So COVID slow burn, influenza hits like a truck, colds and allergies are pretty much very different. And so before I leave, I'm going to revive the song here on the way out for the 5 W's. We're washing and waving and wiping and woo! Don't touch this washing and waving and wiping and woo! Don't touch this washing and waving and wiping and woo! Don't touch this washing and waving and wiping and woo! Don't touch this. We are all doing this. All right. Thank you very much.